9:42 now, and all new this hour, Hillcrest Children and Family Center is expanding its fight against food insecurity with a new community food pantry. It opens next month in December, and to match that launch, they're also hosting an emergency food drive to help stock the shelves for neighbors in need. And this morning, we are joined by the CEO of Hillcrest, an organization 210 years strong. I'm just always so blown away about that. This is Mr. Carol Parks. He is the CEO. And also United Healthcare's Bryna Jefferson to talk more about how you can get involved. Good to see both of you once again.
Good to see you as well.
Thanks for having us.
Absolutely. You know, we were talking before we came on, and I said, my goodness, you all do so much in the community. This is such a huge undertaking, but you said it's an opportunity, and that's just what Hillcrest represents to me and what you stand for. But can you tell us why this is going to be such an opportunity for the people that you serve?
Being that it's an opportunity that allows us to fulfill our mission, which is really to help address food insecurities. We have a lot of clients that suffer from not having adequate food, so this opportunity will allow us to do that for a large amount of our client population.
Right. And Bryna, why get involved as far as United Healthcare goes?
Well, United Healthcare is deeply committed to addressing the non-medical factors that shape a person's health, which we know as social determinants of health.
Right.
So when Hillcrest shared their vision of wanting to relaunch the food pantry, that just aligned perfectly with our mission of helping people live healthier lives.
Right. And how does this work? How will this work? Will it be only for clients of Hillcrest? So tell us how it works and how we can get involved to help.
Well, given that it's connected to our clients and their food insecurities, it will primarily be for our client population.
And how many clients do you serve? That's a village in itself.
We serve over 1,800 clients on a monthly basis.
Right.
So it'll become first come, first serve. But the goal, of course, is to make sure that they have initially the availability of those resources, and then the community can also get involved as well if there's additional resources available.
You spoke a little bit just about this component, like how much do we take for granted having enough to eat, and how that plays in on the total person as far as even psychologically, if you have kids to feed but you can't put food on the table.
Oh, absolutely. It plays a large part. What we've learned, and as I mentioned, we work with very vulnerable population, typically a population that's at a higher risk of having food insecurities. And what we've found is that access to nutritional foods will help chronic disease management, lower stress, and just overall good health.
Right.
So this partnership is more than just a sponsorship. It directly supports the individuals that we serve every single day.
And you know what, let's back up, because I feel like I've become so sort of familiar with the work of Hillcrest, but can you tell us just a little bit about the organization and where it fits into to DC?
Well, as you mentioned earlier, we've been around for 210 years. We have 2 locations.
Which is kind of unimaginable.
2 locations,
okay.
And we serve those individuals that are mentally ill and substance abuse primarily. And they can come to either one of our locations, the 3029 MLK location, which is where the food pantry will be. We provide an array of mental health outpatient services for the 1,800 clients that I mentioned earlier.
And it's, big part of the Hillcrest is the family component too. So you serve the individual, but also the entire family, including probably our most vulnerable, right? The children. The
children, as well as seniors. You know, I just want to make sure we mention that the seniors also are involved with that. We're in 30 different schools in DC, so we work with a lot of youth and families. Over 725 youth and families that are connected to our services.
My goodness. Okay. All right. I'm going to give you the last word as far as just your partnership here, and again why it's so important. From your viewpoint at United Healthcare.
Yeah, exactly. United Healthcare serves a wide range of individuals, right? So people with employer coverage, individuals and families, as you mentioned, and as we heard from Dr. Carol, also Medicare individuals, and that's the older population and those people with disabilities. And so we know that those are the folks that are most vulnerable, that they need the help and they need the support. And we were really glad to be able to help and support this initiative. Right? We know that this partnership is more than just a sponsorship. It's a true alignment to serve the people of our community.
And we appreciate your partnership.
Thank you.
And we appreciate what Hillcrest does in the community and has been
Absolutely.
doing for 2 centuries. So thank you very much. The
Thanks for having
information
us.
there is behind us, and you can go to our website just for more on how you can donate to this food bank that is about to be opening up. All righty, Jonathan, over to you.